Okay, Arian, turn on your webcam, everyone. Thank you. Okay, go ahead. Arian, go ahead. Go. I could not hear you. Go. I think it's you click on the audio setting from the mic, the up arrow. You click on the up arrow. You select the audio. It should fix your problem. Okay, try it one more time.
Does it work now?
Good, that's good. That's working now.
Namo Fundamental Teacher Shakyamuni Buddha. Namo Fundamental Teacher Shakyamuni Buddha. Namo Fundamental Teacher Shakyamuni Buddha. The unsurpassed, deep, profound, subtle, wonderful Dharma in 100,000 million eons is difficult to encounter. Now that I've come to receive and hold it within my sight and hearing, I vow to fathom the thus one comes truth and action.
Good, thank you. Wait, hold on. Okay. We learn about the law of cause and effect a little bit today, just for reading. All right. Okay, so go ahead and read this one wrong. Okay. So, are you there? All right, Phước, are you there? Can you guys hear me?
Yes, I.
Good, good. That call your brother. That you can read this one.
What is the cause of powerful and high position in life?
In this life, okay. What is the cause of powerful and high position? That means it's a high rank. When you work for the government, you're holding the official rank. That means the high position. Okay, in this life, okay, we read the okay, this is the cause. Okay, go ahead, read this one too. There. There, go ahead. There, can you hear me? Okay. Okay, Phước. Okay. Ethan.
What is the cause of sufficient transportation?
Okay. Read this one, go. Ethan.
Building bridges and roads for people in previous lives.
Okay. Good. That means that if this life you have a car to ride, right? For your transportation, that means the previous life you build bridge and road for the other people to walk, to go. Okay, that's good. All right, Phước, are you there?
Yes.
Please pay attention. So, okay. All right, go on. Read your name.
What cause is possessing opulent clothes in this life?
That means that what is the cost for having the beautiful clothes in this life? Okay, here.
Offering the robes to Buddhist monks and nuns in previous lives.
This is what we call the robe for the monks and the nuns. Yeah. To offer to them. All right. So, are you there? Okay, Sophia.
Yes.
Okay, so read this one.
What is the cause of poverty in this life?
Property in this life. Well, we just want to. That. I mean, that's why do this one? Oh my goodness. What happened to you? Sir? So you guys please turn on the webcam. That's why it's very tough for me to teach you guys. If you not pay attention, it's very tough.
Generously giving arm to the poor in previous life.
Okay, anyway, thank you. Yeah, this life you have a good life, right? You have everything you fulfill with the material because in the past you giving to the poor. That's what I mean. Sophia.
What is the cause of being in life? Being selfish and never giving to help or in previous lives.
Yeah, this life, if we are poor, right? Because in the vivid life, we are very selfish. We were very selfish and never give anything to the poor people. But, Kaden, are you there, Carl? Okay. Christina.
What is the cause of having luxurious house in this life? Offering food to the temples in previous life.
That means you are beautiful how due to the past you are offering to the temple. To the temple. Michelle?
It's discreet. What is the cause of being healthy and happy in life?
Read the next one.
Building monasteries and supporting accommodation for people in previous lives.
Okay, thank you. Thank you. Very good. Thank you. Catering, are you there, Con? Yeah? Catering? Patrick Đỗ, are you there, Con? Good.
Yes, I'm here.
Okay, good. Thank you. Okay, you still there. That's good job. Okay, read này con.
What is the cause of beautiful appearance in this life?
Would mean that you want to become beautiful or handsome in this life. What were the cause in the past? Read this one, Patrick.
Offering flowers to the Buddha in previous lives.
Yeah, offering the palm flower to the Buddha. Okay, that's good. Call your sister. Okay. Patrick, call your sister. Ratner. Reading on.
Diligently study Buddhist teachings, chant sutras, and practice meditation in this life.
Read this one too.
Getting wisdom and enlightenment in the next life.
Yeah, if this life we diligently study Buddha, the Buddhist teaching and chanting the sutra and practice the meditation, you will get the wisdom and enlightenment in the next life. Okay. Rana, your sister there?
They're joining.
They're joining right now?
Yes.
Okay, that's good. Okay. So, anyone else? Okay, in the meantime, okay. Okay, that's, I think I got everyone now. Okay, let's do meditation first, then we will go back to our study. Okay. If you guys study and focus, you will learn the good stuff. Okay, keep your back straight, your neck straight, close your eye, inhale and exhale. Count one, inhale and exhale to the nose, count two, keep going, don't hold your breath if you see your monkey mind, and just go back to your inhale. Yeah. 1, 2, 3, start it, sit still and close your eye. Okay, all right. Ariane, Sophia,
12,
15.
Sơn and Ethan Lam, and Christina Võ. Ethan Lam, turn on your webcam, con. Thank you. Kaden, Michelle,
15.
Phước, Catherine, Patrick,
20,
Christina, Chiu, and Serena,
Yeah.
Monica.
Oh, yeah. Sorry, we just joined.
Okay, your sister there, right? Okay.
Yeah.
Right? Okay, right now.
26.
Okay, good. Today I will continue on the depression, but I will, this will take a little bit while. The whole idea I am teaching the depression here is this is a very important subject. The next few weeks, I will walk you through what are the depression and what kind of the risk factor that you have that depression can cause. Those can cause the depression, right? And once you're done with that, I will show you how the Western psychologists dealing with the depression. The Western psychology dealing with the depression, then there are 3 different methods. They are applied from the Western psychology. And after that, I will also incorporate the Buddhist psychology. You will see how this thing deal with the depression. And the good thing about it, Demi, turn on your webcam. The good thing about the depression you learn about this subject is you understand it and you can help yourself, you help others. You know what? Once you understand this, you can save other people's life. Okay? Because when people have too much depression, they can commit suicide. Does that make sense? This is important. Let me turn on the webcam. Okay. Go ahead and do okay. Yeah. All right. Let me read this one. Are you there? Okay, you are not there. That's why it's really tough. All right, Christina Chiu, go ahead reading it.
What is depression? Depression is technically considered a mood disorder but it's far more than that. Depression reach life. It affects not just our mood, it affects our physiology, our health. If you are a child of a depressed, depression is 3 to 6 times greater than if you are the child of a non-depressed parent. Risk factors affected by depression.
Okay,
And how depression?
Okay, stop right there. So you understand this one, right?
Yeah.
That means the depression will affect every part of our life, okay? All right, Serena, go ahead and read the next one.
Risk factors affected by the depression, and how depression serves as a risk factor for many different conditions, most notably cardiovascular disease. In fact, there are cardiologists around the world who are recommending screening for depression as the first screen for cardiovascular disease, but others as well, as it reaches into our ability to think and make decisions. Furthermore, the quality of people's decisions and their way of making decisions actually unintentionally reinforces depression. It affects job performance and our ability to function.
Okay. Okay, keep going.
In the work that we do, it affects concentration. How many work-related accidents that damage people and damage people's lives are caused by inattention caused by depression. It affects relationships. It's hard to be around people who are depressed. It ends up damaging relationships, and of course, all that leads to is more isolation and more depression. The patterns that give rise to depression that affect the quality of life of a lifetime.
Good, that's good. All right. This one right here, let me, okay. Either depression caused by a little bit thing, either depression caused by genetic, no. Depression is not caused by genetic. Genetic, who understand what is genetic? Who understand what is genetic mean? Anyone? What do dummy? Are you there, go? Turn on your webcam, go. Sophia, you understand what is genetic?
They're kind of like genes passed down from your family.
Yeah, that's right. But that means that there is no such thing called depressed gene. Okay, there is no such thing called depressed gene. But genetic disease can cause depression. Okay, that's the difference. For example, if your parents have a certain kind of disease, those kind of disease they pass down to the children because the disease it causes people depressed. Does it make sense? This is important. So we have to make sure we understand the difference. All right. The biochemical imbalance, what is that? All right, let's see. Phước, go ahead and read this one. Phước, are you there? Okay, Runner, read this one.
Yeah.
Okay, read it. What is the chemical?
Chemicals?
Yeah, the first one there. Can you see it? Okay, maybe you cannot see it. Okay. Now, can you see it?
Yeah.
Go ahead and read it.
A chemical imbalance in the brain is said to occur when the brain has either excessive or insufficient chemicals called neurotransmitters. Neurotransmitters are natural chemicals that help ease the communication between your nerve cells. Examples include norepinephrine and serotonin. It's often said that mental health conditions such as depression and anxiety are caused by a chemical imbalance in the brain.
Okay, good. Stop right there. Stop right there. Usually, for the normal person, do we have a problem with the chemical imbalance in our brain?
No.
No. Okay. But when the people have the depression, it will affect our chemical in the brain to become imbalanced. Okay. And that also vice versa. Also, it's also true too. So that means when the brain become very imbalanced to the point that it's very severe. When it becomes too severe, you know what they do? They using the psychologists. They using the antidepressant medication to balance the chemical in our brain. But for temporary. But if they keep using the medication, it will become very bad. Okay, so we will learn in here later on when I show you about the 3 different methods that psychologists in the Western world they are using, and we will see which one is the best. And later, and when I incorporate the Buddhist psychology, it becomes even you will see the beautiful of those things work together. Okay, then that will be very powerful. Remember, this teaching here, this subject right here, usually this is for the professional who learn about psychology. They need to learn this thing, they need to understand this, but you are young, but you be able to have a chance to learn. This is the blessing. If you focus on it and you will understand this, it will help your future. Not only how to train your mind, and you also train your mood, right? The mood of the emotional mood, right? That's how you can become be able to have a better thinking and the better life. If we don't know how to deal with it, we will harm ourselves. Okay, we harm others as well. Okay. Now, okay, let's see. What? Who? Okay, Kathleen Young, read this one. Go.
What are the symptoms of a chemical imbalance in the brain?
Go. Okay, keep going. Read the rest.
Feelings of sadness, helplessness, worthlessness, or empathiness.
No, emptiness.
Overreacting or a loss of appetite.
Overeating or a loss of appetite. Okay.
Insomnia or sleeping too much, restlessness, irritability, a feeling of impending doom or danger.
Okay, good. You know what? The symptom that, okay, when we have the chemical imbalance in our brain, right? The symptom we will have that will make the doctor will, based on this symptom, they know that we have the imbalanced chemical in our brain, like sadness, helplessness, worthlessness, right? Or empty. That means emptiness. That means it's, when we have the flat emotion, that means neither happy nor sadness. And when we have that, that means we have no motivation. Okay, this is called emptiness. That's what it means. Sometimes we changing the pattern of eating. Sometimes we overeating, and that means we always overeating. Or loss of appetite. That means you don't feel like you want to eat, and this is the symptom for the chemical imbalance. And when we sleep too much, right? Or or we sleep too little in no in insomnia. That means sleep too little. Hypersomnia, sleep too much. That also the symptom of the chemical imbalance. This is irritability. That means the people who have the habit of get angry, right? Easily get angry, bad temper. That also cause the chemical imbalance. Okay, a feeling of and danger. That means you feel of danger, right? That nervous. Okay, that's good. Keep going. Let me ask someone else. Okay, Tina, go ahead and read this one.
Which part?
Okay, read this one.
What are the symptoms of a chemical imbalance in the brain? A lack of energy, distancing yourself from others, a feeling of numbness or a lack of empathy, extreme changes in mood, thought of hurting yourself or others, difficulty carrying out day-to-day activities, a feeling of hearing voices in your head, alcohol or drug misuse, difficulty of concentrating.
Stop right there.
Antidepressant medications work.
Good, that's good. Stop right there. You understand what you just read so far?
Yeah.
Good. The people who have the chemical imbalance or due to the chemical imbalance, they have this kind of symptom. That means they have no energy, right? They always want to distance from other people. They isolate themselves. They feel of numbness or lack of empathy. That means they don't have any empathy for other people. Okay, they are extreme change in the mood. That means sometimes they are very happy, sometimes they are very angry or sad. That means they changing so quickly. Um, that means the mood one day it's happy, one day it's sad. That it change rapidly. The thought of hurting yourself or other, that means due to the bad temper, they I think they want to harm themselves and harm other people. Difficulty to carry out the day-to-day tasks because they cannot be able to function any kind of day-to-day task. They feeling a feeling of hearing the voice in your head. Remember, the people who have a problem with hearing the voice in their head, because this is the chemical imbalance in the brain that cause those things. So it's an illusion, right? So it's not real. But when we think it's real, it's become real. And that's why it makes us crazy. They use alcohol and they use drug, and very difficulty for them to concentrate. Okay. Okay, so when the people have the chemical imbalance in the brain, what does psychologists do? They give the medication to the patient. They call it antidepressant medication. Work by increasing the level of the serotonin or another neurotransmitter in the brain to balance the brain. That's what it means. But this is only temporary. It's not the solution. Okay, this is never a good thing to do. Okay. All right. So we understand that part, right? Now, what about system inflation? Let's see what is that. Okay.
Whether you're building dynamic network models
Can you see the
or
video?
forecasting real-world behavior, Neo4j's new graph algorithms book will walk
Anyone?
through hands-on examples of how
Yeah, Thai.
And a new way to study
Right, thank
depression
you.
may lead to more treatment.
All right. Christina, Chiu, can you summarize at the end?
Yeah.
Options for patients. A book just published in the U.S. It's called The Inflamed Mind, a radical new approach to depression, examines the link between inflammation in the body and mental health. It recommends that doctors consider patients' physical and mental histories. It's estimated more than 16 million Americans suffer at least one major depressive episode a year. Mood disorders like clinical depression are also the third most common cause of hospitalizations in the U.S. for adults between the ages of 18 and 44. The author is Edward Bullmore. He's a professor at the University of Cambridge in England. He heads the psychiatry department there, and he joins us this morning at the table. Good to see you, Edward.
Good morning.
Bullmore.
Hi.
Let's start about the connection between inflammation and depression. First, I think you should just give a brief history about what inflammation is and how they're connected.
Okay, so inflammation, a lot of people will be familiar with. It's the body's kind of first line of defense against attack. So if you get an infection in your finger, let's say, it becomes red, swollen, it's obviously inflamed. What people may not understand is that that is just the tip of an iceberg. There's a kind of systemic inflammatory response, inflammatory cells.
Because it spreads.
Throughout the body, circulating throughout the body, and that's how it can get into the brain. It can send a signal to the brain that changes our mood and behavior.
What does the research show about the connection between inflammation and depression?
Okay, so we've known for a long time there's an association. You know, inflammation and depression go together. If you've got arthritis, psoriasis, inflammatory bowel disease, for example, all inflammatory diseases of the body, your risk of depression is going to be much increased. The new understanding is that that association could be causal. It's not just a coincidence. The inflammation could actually be directly causing the depression. And that's a new understanding that we didn't have 20, 30 years ago.
Is inflammation found in all those who suffer from depression?
No. And that's very important because we're not talking about a kind of one-size-fits-all solution to depression. I think that's probably been one of the reasons why we've seen so little therapeutic progress in depression over the last 20, 30 years. It's not just one thing. I think the inflammatory component is probably going to be important for about a third of patients with depression. And then there are a lot of other patients whose primary diagnosis isn't psychiatric. You know, they may have arthritis, as I mentioned already. About a quarter of those will also have depression. So it's not everybody, but it's going to be quite a lot of people.
Can you be having an inflammatory response to something and not know it?
Yes.
And what would that be? What condition would that be?
Well, lots of conditions can cause relatively low-grade inflammation that you might not realize that you have. For example, in the book I talk a lot about dental problems. Those can cause low-grade inflammation. You might not realize it was there. Obesity is another cause of low-grade inflammation. Stress, social stress, can cause inflammation in the body, something that we didn't understand 5, 10 years ago. So there are many factors that wouldn't amount to a disease, wouldn't necessarily have you going to a physician and saying, I've got an inflammatory disorder, but if you do a blood test, there would be some evidence.
We do know about the connection between inflammation and heart disease.
Yes.
We do know about inflammation and dementia, the connections between those things. So the question we have is, and this is something I've recently become very interested in, is anti-inflammatory foods and drugs that we can take, natural drugs. What are they? How can we reduce inflammation?
Yeah, well, it's a critical question. And as you point out, we now understand that inflammation is much more important in many different areas of medicine than we did 20, 30 years ago. So this is another area of change. Now, what can we do about it? Obviously, there are already a lot of anti-inflammatory drugs out there. And we need to do the trials. We need to show that they can directly impact on depression. There's some circumstantial evidence.
But easy ones, like exercising every day.
Exercise, yeah.
Don't smoke.
Yeah.
And you talked about medical apartheid, that really, which I thought was a very strong phrase.
It is a strong phrase.
That we really need to look at this differently.
Well, because
when it comes to treatment.
I think we're a bit split. I think the way that we think about things at the moment, with the mind and the body being quite apart, patients going to see different doctors, different hospitals for treatment of mental and bodily symptoms. I'm not sure that's to the advantage of the patients, and I think we need to break down that barrier between mind and body, and thinking about the inflammatory links and the way that the immune system can communicate from the body to the mind is one way that we can break down that apartheid, as I put it.
I say preach, Edward Bullmore.
Thank you very much.
Thank you so much.
We appreciate you coming. The Inflamed Mind is on sale now wherever you like to buy your book.
Today. Christina.
I missed some parts of it, but what I understood was someone who wrote a book about the inflamed mind said that clinical depression
is the number third reason why hospitals are filled. And he said that there is a connection between inflammation and mental health. Inflammation can affect.
No, not information. Inflammation. Inflammation. You know what is inflammation?
I know that inflammation can affect. It can affect the brain, mood, behavior, and it includes obesity, disordered sleep, illness, infection, and trauma. And inflammation can be caused by stress and others.
Inflammation is, I think it's, because nowadays we actually it's, also come from food, right? If we use a lot of non-organic food, because they a lot of chemical involved in the food. That also cause the inflammation. The inflammation, that means the brain is become infected. I think a part of the brain that cause the stress, the all kind of different sorts like obedience, drama, and so on and so on. But in here, that's what they say. If we exercise more, we do yoga, we do meditation, and use the low sugar, right? That will help us to decrease the inflammation. But it's yeah, I'm still not quite understanding the whole thing clearly. But we just get an idea. It should be good enough for now. We get an idea.
Today I'm going to reveal two.
Right. All right. The cognitive distortion is mean the negative thinking, the negative thought. Information on anything. Okay, this is the cognitive distortion. All right, let's read this one and let's see. Catherine, you want to read this one, girl? Catherine, are you there?
Yeah. What are cognitive distortions? Cognitive distortions are habitual ways of thinking that are often inaccurate and negatively biased. And cognitive distortions usually develop over time in response to adverse events. There are at least 10 common distorted thinking patterns that could have been identified by researchers. Stop leading your thoughts with I should. Should statements can contribute to anxious thought patterns because they put a demand on you that's sometimes impossible to live up to. Everybody makes mistakes.
Okay, good stuff right there. You understand what you said right here?
Yeah.
Tell me what you understand.
It's like it's like the really inaccurate thoughts and that sometimes I should statements aren't good for you.
Usually the distortion, the cognitive distortion, that means the negative thought, right? Or we call pessimistic, not optimistic. So this is just some of the example. I should, usually we should not use the I should, because I should, that means you expect something should happen, right? But what happened if when you said I should do this, but what happened if it not happen? Then you will get stressed and you will get depressed. So instead of say I should, then over here we can use a different way to say the same thing. Okay, this is we can learn from this. Okay, we can learn from this by Nami. Are you there, girl? Nami? What happened to you? Okay, let's see. Kaden, are you there? Okay, Christy, no, I mean, Sophia, this one.
Instead of, I should go to the gym every day, try, I will try my best to go to the gym every day. Here's
Okay, hold on. Tell me the difference. What does it mean?
The other one is just saying what you should do, but the other one maybe is more motivating.
Okay, this is your, let's say that if a person is depressed right now, right? If the depressed person said that I should go to the gym every day, that means he have to, well, he should go every day. What happened? He cannot make it on some day. What happened to him?
He'd be sad.
Yeah, he feels some guilty, right? Don't you think? He feel that he did not commit it to what he said, right? So instead of say I should go to the gym every day, now we say that I would try my best. I would try my best to go to the gym every day. That is different than I should, right? Yet you try your best. If someday that due to the weather you cannot be able to make it, it's okay, right? You see that? You see the difference? So you see the difference?
Yes.
Okay, all right. All right. Christina Vaught, you want to try the second one?
Okay. I should eat healthier and well, instead of I should eat healthier, try I can eat healthier today by doing these things.
Okay, what's the difference between the two?
I guess the first one is like more like forcing yourself to eat healthier, and the second one is trying to motivate yourself to eat healthier.
Yeah, that means that if just let's say that someday you cannot be able to do it, because your schedule is too busy, then you don't feel guilty. You just try your best, right? I can eat healthier today. Okay, that's good. Okay, all right. Okay, now you want to try the next one?
I should stop thinking this way. I see that I'm having anxious thoughts right now. What a more credible thoughts. What would I tell my best?
Okay, what's the difference between the two? This is a little bit tricky. Okay. Okay. Who want to help me to understand the two right here? Who want to try? Okay, Christina Jill, you want to try it? Tell me what the difference between the two.
Difference between what am I saying the difference between?
The three, the third one.
Oh,
I should means that
I should stop thinking this way. And this one right here, so what the difference?
I should stop thinking this way. I think that means that you just push everything aside and you don't confront it, but trying to but your best friend would get it out of your system and you'll have someone to trust in and not worry about it as much.
Okay. Let me try it. Okay. Let's say that this, because this is for the depressed person. If the depressed person say that I should stop thinking this way, do you think that he understand his thinking? Okay. When he said that he stopped thinking this way, that means I don't think he understand whatever the thought he have in his mind, right? But over here, when he said that, I see that I am having anxious thought right now. That means he admit that he having anxious thought. That means he admit, right? He admit that he have it. What is more credible thought? That means the thought is more credible. That means that we can trust, right? What kind of thought that we can trust? That means he know that he have the negative thought right now. He want to make sure that what kind of thought that he have, he could trust the thought. He could trust his thought. That's what we call credible thought. So what would I tell my best friend? So he also very caution that what would I, right? What would I tell my best friend? That means, first of all, he know that he have anxious thought, and he also know that his thought is not reliable because he depressed, right? And that means he have a lot of negative thought. But he also admit that he also know that he will figure out which thought is the best that he to be trust, so he can use those thoughts to tell his best friend. That's what I think. So that means you be able to go and look into your own thought. This the second one here. You look into your own thought and you understand that your problem. When you be able to see your own problem, then you know what, the problem will go away eventually. Okay, does it make sense to you?
Yes.
Okay. All right. Let's see. Ethan Lam, you want to try this one? The number 4?
Huh? I was using the bathroom.
Okay, thank you. Okay, Michelle, you want to try it? Michelle, where are you?
Number 4. I should be able to get on the plane without anxiety. It's kind of like when you're like, you might not do it. You're just giving yourself ideas, and then I wish I wasn't so afraid of flying, but I can accept that I'm working at a solution. What can I do in this moment? It's like you're actually doing it, and you're just giving yourself like how you would do it because you're already doing it.
Okay. Okay, because this depressed person here, he afraid of flying. Okay, basically, he afraid of flying. Flying. That means I think he afraid of the height. Okay. And that's why if the person who were depressed and also have a problem with a fear of flying, but he said that I should be able to get on a plane without anxiety. Do you think that he can get on the plane without anxiety? What do you think, Sophia?
No.
Why not?
Well, if he,
Because he already anxiety, right?
yeah, he says it that way. It's not really gonna hurt him.
But the way he said that, that means he's not too sure that he really overcome the anxiety, but he just say it, right? He just say it. That means he did not see his own problem. You see that? But the second one, I wish I wasn't so afraid of flying. I wish, the word I wish, I wasn't so afraid. That means he admit that he afraid of flying, but I wish, right? I wish. That means he admit that he was afraid of flying, but I accept that I'm working at the solution. That means he tried the best to working on the solution that so he can fly, right? So he can get on the airplane. So what can I do in this moment? That means he admit that he have that problem, and he admit that he working on the solution, and he admit that he don't know what he want to do at this moment, because that he not sure he can be able to get on the claim right now, right? That is good thing, because you have to know yourself. The most important is we need to understand ourselves, because no one can understand you than you are. Does that make sense? Anyone? Sophia, you understand? Okay, this is important. When we understand ourselves, then we can overcome our own problem. If we do not because this one right here, that means he did not understand himself. But with this one right here, he begin to understand himself, and he try to overcome his own problem. Okay. Okay. All right. Okay. Okay. Okay, this is only a few problems. And a lot of time that the people who have depressed because they have the negative thought, right? That harm them a lot. And people, when they have too much negative thinking, do you think that they have a positive feeling? Huh? What do you think? Michelle?
Can you repeat the question again, please?
When the people have too much negative thinking, do you think they have a positive feeling?
Probably not, because if they're having bad feelings all the time, then they probably would rarely have positive feelings.
No, yeah, they would not have the positive feeling. Okay, so that's why when they have a lot of negative thinking, therefore they will have a lot of negative feeling. Therefore, they harm themselves. They harm themselves instead of they harm themselves and they harm the other. That's why the cognitive distortion. This is just only a part of it, yeah. And we will learn more into this later on with the solution. Okay, Patrick, read this one. Patrick, are you there?
Oh, where do I read again?
Okay, at the beginning here.
I have the worst luck in the entire world. I just failed
No,
that
no,
math
no, no.
test. I'm no good at school. Might as well quit.
Read the question.
What are cognitive distortions and how can you change these thinking patterns? I have the worst luck in the whole world. I just failed that math test. I'm no good at school. I might as well quit. She's late. It's raining. Just hydroplane and her car is upside down in a ditch.
Okay.
These
Okay.
are all prime examples.
Okay, stop right here. You see, this why the first one is the negative thinking. What's the first one is? I have a worse luck in the entire world. What would that mean?
They're thinking of themselves as like the worst.
You have the worst luck. Why he claimed the whole world, right? In the entire world. You see, he over generalization. That means yes, you have a world luck, but it doesn't mean that world luck is for the entire world. It's only you, but not the entire world, right? Okay. Christina Võ, do you read this one and tell me why this one is negative?
I just failed that math test. I'm no good at school. I might as well quit. This one's negative because they think they're really bad at school, and yeah.
But you only fail one test. Why I'm no good at school? Why? He using one test fail, and he claimed that for the whole he said that he's not good for the whole school. That means he's not good for all the subjects as well, right? And he said that he want to quit. Is that a good thing? No. Sometimes that he also good, right? So let's say that he have many tests, right? And sometimes he have a good score on the test, and the other time he have a bad score on the other test. But how do we have can we say something that to make a positive for this one? Christina, can you make? Can you turn this negative into positive?
Maybe we could say, I just failed that math test. I'll try harder next time.
Exactly. That is the good one. You see that? When you say that, you see the difference between this one and the one you just said? They are big difference. You see that? That means you try harder, right? That is the good motivation. That is the beautiful motivation right there. Okay, let's see. Serena, you can try this one for me. Oh, we are time up already? Oh my goodness. Yeah, okay, let me stop it here because I have to finish up. Okay, maybe we will continue on next time. Serena, go ahead and read this one. Go.
May every living being, our minds as one and radiant light. May the fruits of peace, the heart of goodness, luminous and bright. May people hear and see how hands and hearts combine in giving unity. May their minds awake to great compassion, wisdom, and support. May kindness and reward, may all whose sorrow leaves with grief and pain. This boundless light be darkness through the endless night. Because our hearts are one, this world of pain turns into paradise. May all become compassion, wise, one.
Okay, you have to be very patient with me and learn about the depression first, why we have the depression, and later on I will show you how the Western psychologists dealing with the depression, and you will also know how to see the Buddhist psychology help the depression even better. Okay, so just be all right. Put our palm together. 1, 2, 3. Nam mô Như Bà Con. Thank you, everyone.
Nam mô Phật chào thầy, cảm ơn thầy.
Dạ, cảm
Nam
ơn
mô
thầy.
Phật. Thầy, cảm ơn thầy.
Cảm ơn thầy.
Okay.